COVID-19 is the latest of the global pandemics to impact the economies of the world and tourism in particular. Over the last 50 years, there have been 3 mega disruptions that have impacted tourism and travel, and that has caused economic disruptions in several communities. The global reality, however, is that in all of these pandemics and/or disruptions that the world has seen, a recovery process has ensued. And tourism, which is the most vulnerable of all the industries, is also the most resilient of all the industries. And so what the world today, in response to COVID-19, as uncertain as that particular pandemic is, needs to do now to build resilience, to build the capacity to respond, to bounce back, and to be able to grow after recovery. In the Caribbean, and Jamaica in particular, we have established the Global Tourism Resilience and Crisis Management Center, the purpose of which is to provide a repository of information, best practices, data that will help to guide countries in building that capacity to bounce back quickly after disruptions. We want to do 2 things today. First, we want to implore and urge that all the communities of the world recognize the protocols that have been established by the World Health Organization and the CDC. In addition, follow carefully the protocols of your own public health department as they seek to enable you to manage better the virus as it hits you, or indeed to prevent the virus from getting close to you. So the first call is to stay at home. Isolation, if you will. The second call is to prevent community spread. And the third and most important call is for you to engage in all the hygienic practices that will enable you to guard against the infection attacking you. We at the center want to urge you again to follow these critical protocols. But at the center also, we want to give you hope that the research is continuing across the globe to find a solution to this problem, that the scientists and the epidemiologists are all combining to create their best approaches and indeed to enable the development of the kinds of vaccine that will respond as quickly as possible to dealing with this problem. But even if we didn't get to solve this problem in the short term, we know that we will solve it in the long run. So what is the call, therefore, beyond all of this? Is for there not to be panic in the system, for us to predicate our actions on facts and scientific evidence, for our leadership to have a clear vision and to offer wise counsel. Finally, for all of us to cooperate, follow the rules of the game, and to make sure that we protect ourselves. And if we protect ourselves, we will protect our community. And when we protect our communities, we protect our nation. And if we protect our nation,